All right, guys, as our next keynote gets mic'd up, has anybody posted a picture yet while they were here about the conference? Yay! And did you hashtag it? Health number 2 conf. Yay! Both of you, high five. Throwing money, Monopoly money, of course. Both your ways. Wonderful. Anybody have any fun plans for tonight, or is everybody flying back? Party. There you go. Says the mom over there. Very good. Very good. Well, whatever you do tonight, I hope it's wonderful. And if you are going to get your chance at the slots, may all the luck be with you. It is that time of the year, right? Magic happens. And it looks like our next keynote is ready, so I can stop my small talk and continue on. Thank you so much again for that last panel and everybody's questions and insight. Moving on, in an ideal world, gender would never stand in the way of quality healthcare. However, even today, transgender and gender non-conforming patients can face many obstacles to healthcare because of stigma and discrimination. In this session, our physician will learn how to understand TGNC communities better while ensuring that their treatment is comprehensive and they are treated in a welcoming setting. This has become a keynote as our panel, for different reasons, they all had to get back home quickly. So let's please welcome our keynote speaker on this topic, Dr. DeShawn Taylor, owner and CEO of Desert Star Family Planning. Please come on up.
Hello. Well, I am very excited to talk about this topic by myself today. There is just so much that physicians can do to help transgender and gender non-conforming people have a better healthcare experience. And so I am a gender-affirming hormone therapy provider. I am the CEO and founder of Desert Star Family Planning in Phoenix, Arizona. And as part of my practice, I provide hormone therapy to transgender adults who are interested in transitioning from female to male or male to female. And during the process of this work, I've also learned so much about how even with transgender care, we think of it on a binary. We think that people want to go directly from being female to male and that people want to go directly from being male to female, but there are so many variations in between. And so it's so important that we are able to meet people where they are and help them live the best life that they see fit for themselves. There's an estimated 1.4 million transgender adults in the United States. And they're living and experiencing hurdles in trying to access healthcare. Many transgender individuals are traumatized by their interactions with healthcare providers. There is real discrimination that they're experiencing. Some of it, unfortunately, is intentional, but a lot of it is unintentional because there is just a lack of understanding about what it means to be transgender. And I think a lot of the times people are grappling with their own understanding of these things. But one of the things that's really important that we learn, especially in medical school, and I'm sure this is the case for many other healthcare professions, is that we are not supposed to bring our own belief system and biases into the interaction that we have with our patients. Our job is to put those things at the door, so to speak, and be present and in the moment and providing the patient in front of us, the person in front of us, with the care that they're asking us for. So whether or not we understand what transgender is or why someone would want to transition, ultimately should not have any bearing on the excellent care that they are expected to receive. The healthcare needs of transgender people are both widely stigmatized and misunderstood. And so what we want to be able to do as providers is create safe environments for people to not only come to us when they absolutely are in dire need of care, but also feel comfortable enough to get their preventive health services provided. So as a gynecologist, I was strongly inspired to provide female to male transgender care. We hear a lot about transgender women. There are a lot of celebrities who are transgender women, but we don't hear very much about trans men. And so I felt that this is probably a really underserved community that I, as a gynecologist, have a sweet spot that I can take care of. Because most people who are female to male transgender are not undergoing surgery. They still have their reproductive organs that still need care and screening. And so what I have found during the time that I've been providing gender-affirming hormone therapy is that there are people who are providing trans people with hormones, but sometimes some of the preventive health pieces are not being adequately addressed. So for example, a trans man still needs to have their first pap smear for cervical cancer screening at the age of 21. Trans men still need human papillomavirus vaccination. All of the things that we would do for a cisgender female, we need to be doing for our trans men. Another important aspect of this is that now that it's starting to become more acceptable for people to be out, where you're going to learn that more of your patients are actually, at minimum, non-binary. And what does that mean? That means that they are not considering themselves necessarily male or female. Some may lean more masculine or feminine. Others may feel different, when they wake up in the morning day by day. And so what's really important is that we respect and ask for their pronouns and use them. Every single patient, whether you suspect that they are LGBTQ+ or not. What I did in my practice is that once I started providing gender-affirming hormone therapy, I wasn't going to say, okay, is this a gender-affirming care patient or not? All patients, all of the forms got updated. Everything asked for pronouns and preferred name. That's the minimum thing that we can do to make gender non-conforming people feel comfortable in our practices. Another important thing, especially as a gynecologist, it's really women-centered, right? And so really, even prior to providing gender-affirming hormone therapy, I had already created an environment where males felt comfortable being in the OBGYN's office. And so trans men then, by extension, had a level of comfort when they were coming into my office for care because it wasn't overly feminine. Definitely, I've created an environment where it's pretty gender neutral. The colors, the photos on the walls, art, and things of that nature reflect all various types of populations of patients that I see. So for example, I have a nice rainbow sunset in the hallway. So that's a nod to my LGBTQ+ people that I'm an ally. I have a trans flag in one of my intake rooms. So that lets my transgender people know that, I'm here for them. And once it became widespread by word of mouth that I was a family provider, now I see an increasing number of people in my practice who are specifically seeking me out because I'm a safe provider for LGBTQ+ people. And then people are now starting to be comfortable having these conversations about, well, I'm lesbian, my partner is a transgender female, and I think I might be transgender. And this is not something that this 40-year-old woman had ever spoken to her gynecologist about previously. And she was having some level of dysphoria around trying to figure out exactly how she was feeling. That became a bit more in top of mind once her partner started to transition. And so I want you guys to understand that in 2021, the Williams Institute School of Law conducted a study and released information about 1.2 million LGBTQ plus adults. And, well, actually, to correct myself, they surveyed LGBTQ plus adults, and 1.2 million of them stated that they were non-binary. So a lot of times when we think about LGBTQ plus people, we think about, okay, someone's gay, someone's lesbian, someone's bisexual. But the important thing is someone's gender identity, who they feel that they are on the inside of them, has nothing to do with what their sexual preference and sexual orientation is. They are completely unrelated. So someone can be a transgender male and be a gay man. And it doesn't mean that that person was a heterosexual female when they were walking through the world as a female. They were still a gay man in their own identity. And now, as an adult, being able to then have their expression match on the outside what they've been feeling in the inside, now they are outwardly male, and they have a sexual preference for men. And now on the outside to the rest of the world, they're a gay man. And so that's a nuance that it's really difficult for people to understand. But if you remember anything from what I'm saying to you today, is that someone's gender identity is who they feel that they are and how they want to express themselves to the world. Some people would like to present masculine, some people would like to present feminine, but some people want to be ambiguous. So sometimes you'll see an individual with a full, nice shaved, shadowed beard and nails and a little bit of lipstick. That's their expression. That's who they're wanting to be. It's really not our business. When we're having a conversation with them, we respect what they want themselves to be called, and we respect their pronouns. And then we share ours. I get misgendered all the time. My name is DeShawn. And I've only met 2 other females named DeShawn. So on email, on telephone messages, on letters, I'm Mr. Taylor. But we don't think twice about that, right? But this happens all the time. Why do we feel so bad or feel some strong emotion about it when it's a transgender person or someone who's gender nonconforming? What is so deeply rooted in us that we have a problem with this? And we have a problem being corrected by it. When people say Mr. Taylor on text message, I say I'm a female. Oh, I'm sorry, it's okay. Now you know when you refer to me, I'm a female, right? And it's the same for our transgender brother and sister. Based on this study that was conducted by Williams Institute School of Law, 11% of LGBTQ people were adults, 78% of them between the ages of 18 to 29. 68% of them said they did not have enough financial resources to make ends meet. 41% reported that their health is in poor or fair condition. And so these are people who are walking among us, and they're struggling on multiple levels because of the stigmatization of who they are by society. And then that internalized stigma that's not allowing them to seek the care they need for fear of further traumatization by people who may mistreat them because of their lack of understanding of who they are and that they even exist. And so some of the things that I would like for providers to consider in making their spaces safer for gender nonconforming people is think about the messages that your space is putting out to all of the people that you serve. Do your spaces make all types of people feel welcome? If you are a space that sees men and women, are there images that show single women, not just couples. Do you have LGBTQ imagery in your office? Like, do you have 2 men in a picture or 2 women in a picture? Are you furthering heteronormative values in the space that you're providing? There's a growing number of young adults who are identifying as LGBTQ+. And so that is a significant population that we're turning off and not serving excellently and not culturally appropriately when we're not showing them, when they don't see themselves represented in the medical space. It's really important now more than ever that we have things like very obvious and visible non-discrimination policies that all of our patients can see, so they understand that this is a space where we're not tolerating discrimination based on age, race, ability status, anything of those nature, because there are so many different marginalized groups who are having negative interactions in the healthcare setting and they're being harmed, and they don't feel empowered enough to let you know. So starting off with something as simple as a visible statement that lets people know that you are not going to tolerate their mistreatment based on their identity, whichever type of identity that their body is holding when they walk into your clinic or your health center, is a good direction to take. Another important thing is to know about your LGBTQ+ resources in the community, so that you can also refer your patients to resources. You don't have to be well versed on what everything is, but definitely know what the major organization or chapter is, so that your LGBTQ+ patients can get plugged into community, where they can also receive additional resources that you may not be privy to or be able to refer them directly to from your clinic. The social and economic marginalization of transgender and gender nonconforming folks is widespread and only exacerbated by a lot of the anti-trans policies that are going around politically. And so it's specifically around youth, but they have widespread impacts about how we practice medicine for gender nonconforming people overall. It has impacts that span way beyond healthcare into education and some other areas. And so, those of us who feel like feel really strongly that we want to have a positive impact in this space, definitely make your voices heard with your state legislators or organizations that work with legislators, like your local AMA and other professional organizations, so that the community knows that physicians are there for them and are holding the mantle for them. And so I did expect to have another person with me to do a chat, so I didn't prepare 50 minutes worth of remarks. But I would love to share a couple of stories about my experience, and then I can also take questions to round out time. And so some of the things that I have learned being a gender-affirming hormone therapy provider is, again, that I was thinking of transgender care on a binary, and most adults who are LGBTQ are not binary. And so there was so much to learn about, okay, you just want, for example, a female to male, you just want a little testosterone, you want to be a little bit more masculine. You don't mind having your period, where the other female to male person is like really distressed when the period comes and they want their period to go away. Another, honestly, thing that I wasn't aware of and had a bias about is, female to male transgender people are still using their vagina for sex, and I was so surprised. And so testosterone is not birth control. And testosterone is also teratogenic. And so it's really important to know wherever your patients fall on the spectrum is if they have female pelvic organs and they're having sex that involves sperm, then a discussion about birth control and their intention or not to be pregnant is part of every encounter. And I just recently placed an intrauterine device for my female to male transgender patient. And I wasn't sure how he was going to do because of all the things you hear about dysphoria and people's concern with pelvic exams and those type of things. And what I found is all they want from us is compassion and honesty and patience. And so once they've developed that trust and bond with you as their provider, then you will get through the exam that's necessary. You will do the things that you need to do for them to keep them healthy. And you get through it together. And they learn from me and I learn from them. And so it is an extreme honor and privilege to be trusted with the care of LGBTQ plus people. And I hope that many more physicians will become comfortable with being an intentional ally to transgender and non-binary people in your practices. You don't have to have special training to provide gender-affirming care. You just have to have an interest and really care. There are a lot of resources available where you can download the information that you need. And as physicians, we have the tools in our toolbox to be able to understand. As an OBGYN, I understand the hormones. And I know the side effects. And I know how to take care of people. So it wasn't a huge leap to decide to do the care. It was really just a matter of making sure the space is safe and that my staff are not misgendering people and upsetting people at the front desk before they even get to me. That's a huge thing. You have to bring your staff along. They have to have education and understand how to interact with people. And sometimes you have to work through some biases and misgivings that the staff have. So some intentional training there, because you as a provider, we have so much knowledge and understanding, but our staff have to be brought along oftentimes, so we want to make sure we're doing the work there. And so with that, I'll take questions if anybody has any. Okay. So I want to just go ahead and close and give some people some additional networking time or whatever, because these sessions go back to back to back to back. And just share one more story before I go. I've learned that there are some hiccups along the way that I'd like to share. A big one is insurance. Insurance is supposed to cover gender-affirming care, but there are still some insurers that are a bit problematic, and so sometimes will require some additional work to get claims paid, especially for female to male transgender patients who have changed their gender markers. And that is something that I'm still working through as a gynecologist in terms of coding these claims to actually get paid. But if there is some type of lobbying or education or whatever is supposed to happen to get insurers to do better, we definitely, physicians providing gender-affirming care, need to be working toward that, because as long as someone still has female pelvic organs, those female pelvic organs still can become diseased, and we still have to do screening, and we should be paid for that care. And so that's been a huge thing that I've been working through in my provision of gender-affirming hormone therapy. Yes, there's a question.
Yeah, I have a question about, I guess, cancer rates. Are they different? Should physicians be more cognizant of what to screen for in this population?
So at this point, there isn't any data that suggests that there is any difference in cancer rates. The recommendation is to do the routine screening as based on the reproductive organs that people have based on current guidelines. There is a paucity of research, though, on transgender people in general. And so a lot of the data that we're working on is based on studies in cisgendered population. But right now, there hasn't been anything that's come out to say that we need to do anything differently. There is something related to male to female transition, and that we do want to have male to females having mammograms because of the growth of breast tissue there.
Thank you.
So I'm a physician in Texas, which is a real hotbed of bigotry against transgender people in general. And we've had a recent decision by the courts that allowed, we have our Attorney General, our Lieutenant Governor, and our Governor campaigning very vigorously against allowing gender-affirming surgery or treatment, but a recent court decision that allowed the physician at Dallas Children's to continue doing that. One of the things I'm hearing from people that I know who are parents of kids in the age group, in younger age groups, preteen and teenagers who are expressing ambivalence, is that this is just a fad. These kids, my kid really isn't transgender. I've heard that from several. And I'd like to hear a little bit about how you respond to that when you hear that. And then a personal vignette. I have a 9-year-old grandchild. My grandchild is an out-of-the-box thinker and has been since she's about 4. And so we visited her in California recently, and she was dressing very masculine, let's put it that way, the stereotype of male dressing, and rejecting dresses. And my wife was making a big deal of it, and I said, wait a minute, figure out where she is and who she is. She's really figuring out right now who she is and what she wants to be. Let her be that. Let's see where it leads. So 2 weeks later, she went to an event and dressed up in a fancy dress. So, in her case, it really was. She was figuring it out. But I do feel for those parents who are in that stage, and somebody like you who has the experience probably can help us all with understanding how to deal with parents or our own kids and grandkids when they go through that. Thank you.
Thank you for that, and thank you for sharing that story, because I was having a conversation with someone recently about that. I was a tomboy, so I rejected dresses, but I love them now as an adult woman. So, so I specifically chose to provide gender-affirming hormone therapy to adults who, through an informed consent process, because it is very challenging, mainly to address parents and their concerns around their children and their gender identities. What I can share from my experience as taking care of adults who are transitioning is that they knew when they were in elementary school that they were transgender. And they spent the majority of their childhood in distress about not being able to express who they were, constantly being misgendered because they didn't feel like they were in the correct body. And so now as an adult, they're in therapy, they're on multiple medications for their emotional and mental health. And when they start the hormone therapy and they start to feel like they're taking control over their identity and their expression in the world, and that especially once the secondary changes start to occur and that outward expression when people look at them and say that they are who they believe they are, their mental and emotional health improves. And I've seen it in my own practice. And it's hard when you're looking at your child, and there's a lot of discussion around when is it too early to do surgery? Is it too early to start hormones? And it really is a matter of, if you create the relationship of open communication where your child can tell you who they are. I will say that as an adult gender-affirming care provider, many adults do not have surgery. So I don't know how, I haven't formed an opinion about minors or people who are not adults having surgery to change who they are. That might be something that's probably a better idea once they're adult and they can do full informed consent about that. But I can say that people, adults who are very distressed, have been distressed for most of their childhood.
I sort of have an answer on that. It really does depend on the maturity and the ability to abstract. Kohlberg, part of my training is in adolescent medicine. And so Kohlberg, years ago, surveyed large samples of people internationally about the ability to think abstractly. And there are instruments available where you can assess the ability of a person to abstract and to understand the consequences of their action. And in our society, the mean age for doing that, and it's probably a bit younger now, was 16 when Kohlberg did his work. It's probably younger now, but you can do that sort of assessment, which helps you guide you on whether this child is ready, or this person who is still a child by our rules is actually mature enough to make that decision on their own. And this is a case where I think the science can drive where we go with that. The pushback that we're seeing, frankly, from the politicians is completely irrational. Yeah. It's totally unethical because it interferes with the ability of physicians to deliver compassionate medicine. And unfortunately, those idiots all got reelected.
Yes, everywhere. Thank you so much for that. I will say that I think that I love that, because currently for gender-affirming hormone therapy for youth, there is a required psychological assessment before hormone therapy is even started, and especially before surgery to transition with surgery. And so hopefully, that type of assessment is happening. And, I hear this contrasting statement about how, we have young teenagers, females, who are allowed to get breast augmentations. And how is that any different than someone of the same age wanting affirmative gender surgery? And so we have to ask ourselves, why is one different than the other? And it really is underlying biases about who deserves to live their outward expression and who doesn't. Thanks.
I just wanted to say I've personally a lot of empathy for people who are looking for a community where they fit in with and they thrive in. I believe that everyone should seek those communities where they belong. And I do want to say, as a parent, I've never met an adult who didn't look upwards to their parents and think like, well, they did, everything perfectly. And I've never met a parent that I've looked at and thought, oh, they are the perfect parents. So I just want to say thank you for electing to serve the adult community on this matter, especially within the pharmaceutical realm, because I think that there's enough challenges between parents and children alone without, an external force trying to place a wedge between them. So just, I from the bottom of my heart, thank you for electing that decision that you made.
Yeah, and to speak to that comment, it's a fine line to walk as a provider in the middle of relationships between children and their parents. I mean, as a gynecologist, I take care of young women, and they confide in me things that they haven't talked to their parents about. And my job is to be a trusted adult that they can have these conversations with, and also try to move them toward a place where they can actually have these conversations with their parents. And so I personally have, been the constant female influence in a few of my young patients' life, as there have been different women divorced from mom, new girlfriend, now no new girlfriend, and so I think that we don't want to raise that practitioner-patient relationship above someone's parent-child relationship, but I also want people to understand how important that relationship is when youth really look to us as a source of safety, and we can use that relationship to empower them, to advocate for themselves, and also hopefully help bridge the gap between their communication with their parents. Well, on that note, thank you guys so much. I really appreciated the comments and questions, and I hope that you found this information useful.
Thank you.